Hello, hi, this is Dr. Karen Perez, and today we'll be discussing how to measure visual acuity. So, what is one measuring visual acuity? When we measure visual acuity, what we're actually looking at is the sharpness of the vision. This is measured by the ability to discern letters or number at a given distance according to the standard, and in this case, it is 20 feet. So we'll be looking at near vision, distant vision, and peripheral vision. So with testing central vision, the patient should be positioned 20 feet from the saline chart. Now, the structure of the eye that is responsible for the central vision is actually the optic nerve. That is cranial nerve number 2 that innervates the optic nerve. So, each eye should be tested separately. So the patient should cover one eye, then it should be tested, then cover the next, and the other should be tested. Now, if the patient wears glasses, the test should be conducted without glasses first, then the result documented, and then afterwards the person can put on their glasses and then the vision tested again. The results are recorded in fraction. So the numerator, which is the top number, this actually measures the distance a patient stood from the saline chart, which is 20 feet. The bottom number, which is the denominator, this is the distance an average eye can see the line. So a 20/20 vision, meaning that the person stays from 20 feet, stay at 20 feet, which is the numerator, and the denominator is where the average eye can see, which is normally 20 feet, and that is considered good vision, 20/20. Now, what does it mean when it says that someone has 2200? It means that where the person is standing, where the patient is standing, which is 20 feet, the average eye, and see the line, the average eye can stay at 200 feet and see that. Again, what does it mean when we say 2200 or 2030 or 2040? It means that the person is standing at 20 feet and the person, the average eye, can see the same thing that person is seeing at 20 feet can see it at 200 feet. So that means this person definitely have an eye issue. Measurement for near vision. So they will use the Rosenbaum card, and it is most widely used. The card is held in the hand at arm's length, and then the patient will read the number, the instruction given by the healthcare provider of what line to read, and that's how they measure near vision. Peripheral vision, the test that is used is called a confrontation test or confrontation visual field test. Now, what they will do is the practitioner will cover their left eye while the patient cover their right. So what that means, on the same side, look at the picture, they will be covering the eye facing each other. So on the peripheral, the practitioner would, after asking the patient to cover their right eye while the practitioner covered their left, so the open eye are directly opposite from each other, then both the patient and the practitioner then should be looking at each other eye. So with that, the practitioner will fully extend their arm midway between the patient and themselves, and then move the arm in slowly centrally. So the practitioner should have the patient tell them when they can see the fingers the first time. Again, so the arms will be extended, the practitioner will move the fingers slowly, and then the patient will tell the practitioner when they can see the first time they see the fingers within their peripheral vision. So compare the patient response to the time you first count the finger. So you're going to compare the patient response to when you yourself first see the finger. So again, a confrontation visual field test. The practitioner will sit facing the patient. The practitioner covers the left eye, the patient covers the right eye. What this will result in is that both eyes will be seeing each other on the same side. The practitioner again will extend the arm out, taking slowly the arm in, and the patient should tell the practitioner when they're able to see their finger without turning their head in their peripheral vision. And the practitioner is going to check if they can see their own finger at the same time too. So that's how the peripheral vision is tested. So I hope this video was very helpful. Please make your comments in the comment box. Thank you so much for watching.